A community in shock.
It's sickening.
A father in pain demanding action.
I've got to do something.
In Sault Ste. Marie, Ontario, 4 people shot and killed, including 3 children.
I'm angry because these deaths just keep on happening.
What needs to happen to prevent intimate partner violence?
If it's a matter of putting a label of epidemic on it, then so be it.
The CBC's Katie Nicholson joins us again from the vigil in Sault Ste. Marie. And Katie, tell us what you've been hearing from people there.
You know, this really was important for people to come out tonight. The weather was absolutely miserable, cold, rainy, windy, and yet people stood there for 2 hours just to show support to one another, to the families who were here, the families of the victims. And you know, you have to understand, this is the actual first time that they have had to come together as a community since all of these events unfolded on Monday night. It's a community that is still dealing with grief on so many different levels. There were so many difficult conversations held throughout this week. In a city this size, you really notice when suddenly 3 children don't show up to school anymore, parents having to explain to children what happened as best they can, and children feeling traumatized by this and all of these difficult moments. So tonight what we saw is everybody coming together and comforting one another, but they were also there for Brian Sweeney. He's the father of Angie Sweeney, the first woman who was killed that night, and he had this to say as a promise, a vow to other families that others don't have to go through what he and the other families are going through right now.
I've got to do something so that no other family in this country will suffer the way that my family and my extended family, my girls that I call all my daughter's girlfriends are all my girls because they're special people, and my daughter helped make them special people. And they are going to be part with me to get a movement going here to stop all this terrible nonsense and violence. And I'm not just going to start here. I am going to ask our Mr. Ford if he could find some time a day, because I would have a conversation with him and have a few suggestions.
Brian Sweeney also took this opportunity to talk about his daughter, how kind, how generous she was, how she helped out everybody in the family, driving her uncle to medical appointments, and just how deeply her loss is being felt within the family fabric right now.
And Katie, I know one of the things you're hearing is calls for change.
That's right. I mean, this is coming hot off of the inquest in Renfrew County, 86 recommendations, many of them not enacted by the province. And so people here, advocates for women's shelters, and now these families touched by this incident are calling for change, but so too are city councillors. Angela Caputo on Monday night is going to introduce a motion to declare intimate partner violence an epidemic in this city. Here's Angela Caputo.
It's interesting because the Ontario government under Doug Ford has refused to call it an epidemic, citing that epidemic refers to disease. Yet the World Health Organization is saying violence against women, particularly intimate partner violence and sexual abuse, is a major health issue, and it's a violation of women's rights.
So Caputo does expect that this motion will pass unanimously on Monday night. It's not really going to do anything immediately, but she hopes that it really puts a focus on intimate partner violence in this community and starts to unlock funding from other sources so they can really address the roots of the problem here.
A difficult but important story. Katie, thank you very much. And earlier this week, Katie asked Sault Ste. Marie's police chief what he thinks needs to be done about intimate partner violence. And here is some of Hugh Stevenson's response.
I'm a firm supporter that something has to be done to raise the awareness of the issue. And if it's a matter of putting a label of epidemic on it, then so be it. What it does is it draws attention to the issue that it's not simply a private family matter, it's a societal matter. And to get it treated that way at a higher level of thinking, then maybe we do need to call it something a little more serious than what we refer it to as. It starts in the schools, it starts in the churches, it starts in our social clubs, and we engender respect. And then when we see sickness, we can deal with it. But if we avoid it, this will continue.
Pamela Cross is a lawyer and a member of Ontario's Domestic Violence Death Review Committee. And I'm curious about what went through your mind when you first heard that news from Sault Ste. Marie.
I had three different reactions really all at once, Ian. I, of course, felt a great deal of sorrow that more lives had been lost to an act of intimate partner violence. But I also felt frustrated and I also felt angry because it's almost the end of 2023. We know what we need to do to prevent these deaths from happening, and yet they continue to happen.
We know so little, so few details from Sault Ste. Marie. Is there anything you've heard to this point that makes you think, okay, here's something that should have been done differently up there?
It's really too early to start to do that kind of analysis. I think one thing I'll say on the positive side is that I was really pleased that very early on, the chief of police identified this as an intimate partner violence event. Very often, the police will say things like, there's no danger to the public. And those of us who do this work know that means, oh, this was probably an intimate partner violence incident of one kind or another. But the police in Sault Ste. Marie identified it for what it was right away. A couple of days later, we heard that there had been a call to the police, perhaps 1 or 2 days before the shootings. But even that, it's impossible to interpret what that call was about. Was it one in which someone was asking for help? Were they looking for information? We just don't know. It's too early to analyze the details of this particular case.
As you know, we have a limited amount of time here for this interview, but I wonder if you can give me, and you can decide, is it 1 or 2 or 3 examples of things that can be done, whether it's in Ontario or other parts of the country as well, to prevent or at least reduce the number of these murders in the future?
One thing that we need to do everywhere in this country is to understand that addressing this issue takes an all-of-society approach. Lots of systems need reforms, always. Lots of systems need more money, but we all have a role to play in this. And so we need to be paying attention to the people around us, the people we care about, the people we work with, so that we're noticing whether something isn't right. And then we need to be ready to ask that person, are you okay? What can I do to help? That's not going to solve the problem, but if we just turn our backs on these situations because we feel too awkward about getting involved, there will continue to be these kinds of deaths. And importantly, thousands and thousands of more situations that don't result in death, but in which a woman usually is being victimized by her partner.
And you come to this with a lot of study, right? You know a lot about this. And so let me ask you, those small interventions, if I can call them small interventions on a personal level. I mean, I understand theoretically that's a good idea, but will they actually save lives?
They will save lives. Women who are in relationships where their partner is abusing them often feel very isolated. They think, oh, this is just about me. Nobody else is going to believe me. As soon as they know that there's somebody there who believes them, they're able to reach out for help. That help might mean leaving the relationship, going into a shelter. It might mean getting counseling and trying to make the relationship work. But until that person feels like they have somebody who will believe them and who they can trust, they are so isolated that it increases their risk significantly.
Little time left, but let me just say, so often in these cases, we don't hear a lot about it. We don't even know what the nature of the crime is. How important is it for us, while still being sensitive to privacy, to know kind of what's happened in these cases and see what lessons we can learn from them?
I think it's important for the public to know generally what happened. This is an act of intimate partner violence. Here's who harmed whom. Here's who the victims are, and here's how they're related to one another. We don't need to know the intimate details of exactly what went on. That's information that family members or close friends might feel that they need to have, but the rest of us don't need to know that. We need to know enough so that we can say, aha, this is one of these kinds of situations, and here are the things we need to do to stop that from happening again.
And we need to have people like you helping us understand how to prevent this in the future. Pamela Cross, thank you very much.
Thank you, Ian.
Pamela Cross is a lawyer and a member of Ontario's Domestic Violence Death Review Committee.